Now we actually looked at the two types of syphilis. That's the syphilis that somebody could be born with. That's the congenital syphilis. Then also syphilis that someone acquires. So after looking at these two, it's good for us to now settle back and look at the clinical features. That's like the signs, you know, and also what symptoms, you know. So congenital syphilis, you know, person is having it as a result of they were born with it. So congenital syphilis has a lot of clinical features which you can see early on in birth and also the ones that you can see later, we should be looking at. So for the ones that you see early on in birth, that's like the person was born within from the birth, you know, to 2 years. So on the skin and mucous membrane, the skin and mucous membrane, you're having maculopapular rashes, you're having mucus patches, you know, you're having shuffles, that's persistent nasal discharge with blood and also spirochetes. In the bone, you're having what? Osteochondritis, periostitis, and also pseudoparalysis or the parrot. The person doesn't want to move that limb. You understand? Then systemic signs, there's swelling of the liver, swelling of the spleen, jaundice, anemia, failure to thrive. Other features like lymphadenopathy, neurological involvement, the person is having meningitis, the person is having seizures. You understand? So this is it, and you can see the early signs, skeletal findings, late one, which we are going to now talk about. So for the late one, you are having what? The Hutchinson's triad. So the person is having Hutchinson's teeth. We look at that. Interstitial keratitis. We also look at that as eye inflammation. Sensorineural deafness. Skeletal deformities like saber shins, saddle nose deformities, Cloton's joint, you know. So other stigmata, okay, developmental delays, seizures, intellectual disability. Other stigmata, they're having a high eighth palate, also the mulberry molars, also scarrings around the mouth, also known as what? Bragates. Okay. So this is everything, as concerns syphilis. This is what we got.